Paeds at Ease, where we put you at ease about all our children's health needs. My name is Dr. Sandra and I'm a pediatrician. Join me today in part 2, where we'll be speaking about problems in growth, especially in the first 6 months. If you haven't watched my first video, I'd encourage you to go please watch that video where we speak about normal growth in the first 6 months. As we spoke in the first video, we determined growth, or rather the most important time of growth is the first 1,000 days. Now these first 1,000 days are from conception to 2 years of life. And the input that you give in this first 1,000 days is extremely important in terms of the growth of the child. If you feel that you're in a situation where this wasn't done, please don't give up, don't have any despair, because any good input that you give in a child's life will yield fruit later on. The best thing is to have proper input in the first 1,000 days. However, any good input will be good for the child. Now moving on, if you find me looking down, it's because I'm looking at my notebook to make sure that I follow the sequence for the information that we'd like to discuss today. Pregnancy, as we discussed before, is divided into 3 trimesters, 3 months each, because a pregnancy to term is about 9 months. And we want to focus on the first trimester now. Problems in the first trimester can actually cause the most damage to the child, because this time in a baby's life is when all the organs are being formed. So if anything goes wrong in this first part of a child's life, that means there'll be the most damage to the body. The first thing I discussed before was that we want a pregnancy to be as healthy as possible, and it is important to start doing the things that you do in pregnancy already before a woman falls pregnant. Now, if you're planning to fall pregnant, or if your partner is planning to fall pregnant, or your friend is planning to fall pregnant, I'd like to encourage you to always rather go to the clinic or to your obstetrician. This is important because there are a lot of things that are checked. We check for your weight, we check how whether you have any pre-existing conditions that might affect the pregnancy. We check for certain infections such as HIV and other sexually transmitted diseases, because by treating these diseases you can actually ensure that you have a healthy pregnancy. We also check for things like the blood group, and we check for things that what we call the RH factor, which is called the rhesus factor. This is part of the blood group that will also affect whether the baby has a danger of having anemia, which is a low blood count when the baby is born. If a mother is rhesus negative and the baby is rhesus positive, this may cause problems with what we call rhesus incompatibility. This is why it is important to be able to check the mom, to know her blood group, to know her blood type, to prevent such issues that might cause jaundice or anemia if the baby is born. I'll do another video about jaundice in children because it's an extensive topic, and so I won't be covering that in this video. Now, as we spoke about before, to protect the brain and the spinal cord, we need folic acid, which is also called vitamin B9 or folate. This is important to prevent a condition called spina bifida, where the spinal cord at the back doesn't form properly and the skin doesn't close properly, and because the spinal cord and the nerves are exposed, the baby may end up paralyzed or partially paralyzed. To help prevent this, you take folic acid already before falling pregnant, and especially in the first trimester, in the first 3 months of pregnancy. The other thing that is important is to avoid alcohol, to avoid illicit drugs, because these can really affect the brain development, they can affect the heart development, they can affect the whole size of the body. And also, even if the baby is born looking normal, when the baby is a bit older, might present with certain psychiatric or behavioral issues because of alcohol and drugs during pregnancy. Smoking is also very dangerous. The baby might be born much smaller than they were supposed to be, and it can also affect the heart and the brain and other organs. Alcohol and smoking is also a big risk factor for the baby being born stillborn or even a miscarriage. Another thing that you have to remember is that certain medications are extremely dangerous for the baby. For example, certain blood pressure medications, warfarin is very dangerous for the baby, certain pain medications, certain medications for epilepsy. That's why it's really important to discuss with your doctor about the medication you're already on in order for them to either stop that medication within reason or substitute to something else that would be safer for your pregnancy. This is why you have to make sure you're being seen by an obstetrician or you're being seen by your midwife to follow you throughout pregnancy to make sure that you're fine. Another thing that people sometimes forget is that herbs are not always very good. Just because something is listed as natural doesn't mean it's actually healthy for you in pregnancy. So you have to double check and don't just take herbal supplements just because they're herbal. They might be dangerous in pregnancy, so keep checking. For example, ginseng is really not good for pregnancy. One herb or spice that would be good in pregnancy is ginger. Ginger is safe in pregnancy. You can take certain fruits like strawberry or coconut. Those are very safe and very helpful in pregnancy. So just make sure you are checking with the manufacturer and with your doctor or your nurse to make sure that what you're taking, even if it's a herbal supplement, that it contains things that are actually safe in pregnancy. A problem that can be encountered in the first or second trimester, so moving on to the second trimester, is certain conditions that develop in pregnancy that were not there before and are only associated with pregnancy. The first one that can be very common is what we call gestational hypertension or high blood pressure. Now this can cause, it's one of the biggest causes of a baby needing to be born premature because of the fact that we may have to do an emergency cesarean section earlier in the pregnancy in order to protect both mother and baby. It's important to make sure that you are taking the medication that you're given if this is a condition that you're diagnosed with, and that the baby and you are being checked regularly. So the other problem can be gestational diabetes. Diabetes is a condition that can occur in pregnancy where the metabolism of sugar, or how your body processes the sugar in the body, is actually not proper. And so the insulin being produced by the body, the insulin is a hormone produced by your body to be able to take in sugar into your cells for the cells to use. And the insulin then actually isn't working the way it's supposed to work. This baby can be born actually too big. The baby can be born much bigger than anticipated, and the baby may also be born premature. So these babies sometimes look big but are actually extremely immature, and they may need help after being born with help breathing with a ventilator. They may also be born with problems with sugar, where the sugar actually goes really low because they were used to a very high insulin level in the womb, and therefore many times they have to be admitted into the ICU for a couple of hours or even a few days so that we make sure that their sugar levels are fine. So if this happens to you, make sure that the doctors or the nurses keep checking you to make sure your sugar levels are fine, so that we make sure the baby's sugar levels are also fine in pregnancy. And if the baby is born premature for many reasons, as we said, it can be because of the sicknesses in pregnancy or certain diseases in pregnancy. For whatever reason, the baby may be born premature. What happens? Prematurity means the baby was born before 37 weeks, and this means the baby was born too early, premature. 40 weeks is what we call term, but any baby born about 38 to 40 weeks is considered completely fine. If the baby is born between 37 and 38 weeks, we also consider that that's actually okay. We just might double check them, but usually, especially if the baby was born naturally, usually the baby is quite fine. If the baby is born between 34 weeks and 36 weeks, which is about 8 months pregnant, that baby is called a late prem. This baby might be a very good weight, might not have problems, but may need to be checked very carefully to make sure that everything is okay before we send them home. A baby born between 32 and 34 weeks, which is between about 7 to 8 months, this one is really moderately preterm. Between 28 and 32 weeks, or even between 26 and 28 weeks, this is a very premature baby. That's between seven months and a micro-prem is a baby born even before 26 weeks, so before 5.5 months pregnancy, is a very, very, very small baby. So premature babies have quite a few problems, and that's why they need to stay in the hospital for maybe a month or maybe 2 months before a mom can take the baby home. These babies have immature brains, meaning they're prone to bleeding. They have immature skins, so they can't keep themselves warm, and they have a big chance of getting an injury to the skin. So you have to be very, very careful because the skin is extremely delicate. They have immature muscles, so they're unable to hold themselves in a folded way, which a full-term baby would be positioned, and therefore you have to position the baby properly to make sure they develop well. They're unable to suck, so they still have to learn how to suck, so you have to assist them with feeding. They have immature organs, so the whole body, even when we feed, we start feeding very, very slowly, and we try to keep it to breast milk only, because there are dangers that they're not going to be able to actually digest the food properly. They have an immature immune system. They have immature lungs. Many of them need to be on ventilators, either external ventilators or attached to a ventilator for a long time in order to allow them to breathe properly. So they really need a lot of support, and mothers and fathers who have experienced this, you know that it can be an extremely scary and just an overwhelming experience. And I would encourage you to seek help and not just keep those feelings inside. It's important to know that you're not alone, and this is an unexpected situation and you need help. For families who've gone through that, for grandparents or aunties or uncles who are going through this, it's important to stay close as a family in order to support one another, because it's a stressful and extremely trying time as a family when the baby was born at a time when you didn't expect, and the baby now is in hospital, maybe in ICU, or still growing, and sometimes you hear about different problems that the baby may be going through. So it's important to continue communication with the nursing staff at the hospital and the doctor at the hospital. Speak to your pediatrician, communicate all the time, and know that you are supported. Before the baby goes home, in the ward they'll be admitted in an incubator because the baby is not able to keep themselves warm. But usually the baby is discharged home at around 1.8 to 2 kilograms, which is about 4 to 4.4 pounds. And around the time when we are getting ready to send the baby home, we might put the baby out of the incubator in what we call kangaroo mother care, where the baby is placed naked with just a nappy in between the breasts, so that the baby can keep warm. And what's so wonderful about kangaroo mother care is that the mom's body increases by up to 2 degrees to keep the baby warm, and decreases up to 2 degrees if the baby is too hot, which is absolutely incredible. Different members of the family can assist with this, and if the father does it, then it's called kangaroo father care, or KFC. And what's fascinating is that on the father's body doesn't actually go up and down like the mother's body does, and the baby might actually get a little bit too hot, which is really interesting. So even with this, the whole family can assist with this, and the baby being skin to skin with one of the family members is really important for the baby to keep warm, for the baby's brain development, and if the baby's on the mother, it helps with breast milk production, and it just helps overall bonding. I would encourage you, if you have a baby who you've just gone home with, who is premature and still about 2 kilograms or about 4 pounds, please rather put this baby in kangaroo mother care at home until the baby is above 3 kilograms or above about 6.6 pounds. This will help with the development and really help with the baby actually keeping their warmth. We usually weigh these babies when they go home, and we weigh them about weekly until we see that the baby is actually gaining weight properly. So in the ward, usually the premature babies will be on a certain amount of milk, and by the time the babies go home, we try that the babies are already on fully breastfeeding. But let's say you have a baby who went home smaller than the weight that you expected, because normal weight is between 2.5 to 3.5 kilograms. So if I have a baby who went home smaller than that for whatever reason, one of the questions I was asked by one of the moms is, what can we do to help the baby gain weight? So in the ward, we usually put in the breast milk, we can add a breast milk fortifier, but that's not available when you go home. And at home, what is wonderful is that a baby cannot be overfed if you breastfeed. A breastfed baby cannot be fed more than actually is supposed to. So the baby can be put on a schedule, and if the baby is hungry, you feed even more than that schedule, or the baby can be fed on demand, which is amazing. And just following, just breastfeeding on demand or on schedule can achieve really good growth parameters. If your baby is formula feeding, I'd like to give you a calculation to just know that your baby is feeding correctly. A premature baby or a baby at term, usually when they're sent home, we give this calculation, which is 150 mils multiplied by the kilograms of the baby, and this will give you the total amount in milliliters over 24 hours. This is then divided into feeds that are given about every 3 hours. So a formula fed baby has to be fed on schedule. Breastfed baby doesn't have to be fed on schedule, and this is important to realize. This is about 2.5 ounces for every pound, if you're calculating in pounds. And the thing is that formula fed baby, if you follow this, usually you're quite fine. We might increase from 150 to 160 mils per kg, or up to, if we're dealing with premature, we might go all the way up to 200. But if it's a baby who's been born at term, we use the calculation 150 times the kilogram of the baby. Get this in milliliters over 24 hours. It is possible to overfeed a formula baby because sometimes they're crying and they want more milk. So you have to be very careful to just give them a very small amount of milk, because sometimes if you give them too much, they will drink the large amount of milk and you might actually end up overfeeding the baby. So you have to be very careful. That's why it's important to still discuss with your pediatrician, still discuss with your nurse practitioner to make sure that you're not actually giving too much, because the baby might end up feeding. Many babies might not, but some babies do end up feeding a little bit too much, and that might be a problem later on. Please comment below and tell me if there are other problems in growth in the first 6 months that you'd like to discuss, and join us in the next video where we'll be discussing how to grow a baby optimally after 6 months, where we've started adding solids. Thank you. Like and share and subscribe.